Hello, everyone. Happy Tuesday, and welcome to the latest installment of the Laser Skin Surgery Center webinar series. Today, I'm very excited that we have Dr. Michelle Henry here with us. Hi, Dr. Henry.
Hi.
And Dr. Henry is going to be speaking about neck and jawline procedures. And I hope I'm not the only one that stares at a Zoom screen all day and just kind of goes like this and looks at my neck and jawline. So I'm really excited to see all the tips and secrets that Dr. Henry has in store for us. She has a short presentation, and then when we're finished, there's going to be time for questions and answers. So on the bottom of your screen, there is or if you're on the Zoom webinar, there is a little Q&A feature, and it would be great if you could start submitting your questions there. You can start now as she's speaking or at the end. This is streaming live on Facebook. And if you do miss anything, it is being recorded and we will email it out to you guys, so you can always rewatch it again so you don't miss any of these little pearls. So I see a lot of you joining right now. If you're just joining, you are joining the Laser Skin Surgery Center webinar with Dr. Michelle Henry on neck and jawline procedures. So I feel like Dr. Henry does not need that much of an introduction because most of you know her or you've seen her. She's all over the news and the media. She's a very established and respected board certified dermatologist. We're very lucky to have her and we're so happy she's here today. I'm going to let her introduce herself a little bit more and let her take over.
Yes. Hello, guys. So again, my name is Dr. Michelle Henry. I am a board certified dermatologist and dermatologic surgeon. I'm practicing here at the Laser and Skin Surgery Center of New York. And I do the full range of dermatology. So I do everything from skin checks and acne to Mohs surgery, which is a specialized type of skin cancer surgery, to all of the aesthetic procedures, including injectables and lasers. I also do liposuction. I do a lot of hairs. I do all things dermatology, which is why I absolutely love dermatology, because it is a quite varied practice and it keeps it interesting and fun. And I am very excited to talk to you guys today about neck and jawline procedures. And so I'm going to focus on those procedures that I do more frequently. It's definitely not an exhaustive list. The fantastic thing about having 12, are we at 12 now? Physicians
17.
Oh my God, 17 physicians in the office is that we basically cover everything that can be done here with many dermatologists and many plastic surgeons. So I'll be talking about the things that I focus on, but whatever it is that you're interested in, there is likely someone here who does it. And if you have questions about that procedure, I can also answer questions about that as well. So we'll dive into neck and jawline procedures. And what's interesting to me is that, when we talk about aesthetics and we talk about anti-aging, when we talk about rejuvenation, we often talk about the upper face. So we talk about, neurotoxin in the forehead, neurotoxin in the eyes. We often don't talk much about the lower face and the neck. And what I find a lot of my patients is that many of them start aging in the neck earlier than some of the facial signs. So it really is a critical area to think about, to not miss, and to focus on throughout, the course of your anti-aging treatment, or your master plan, as I call it with my patients. So we're going to move on to the next slide.
Before you get into this, could I do the little survey?
Of course.
Okay, so everyone, I have a little poll that should have popped up on your screen right now. Unless you are streaming live on Facebook. And if so, you can chat in your feedback. But this will just help Dr. Henry understand a little bit of who she's speaking with. So the first one is kind of what decade of life are you in? So we know everyone's age. What aesthetic treatments have you tried? Do you guys see the poll up? Okay, they're coming in. What aesthetic treatments have you tried? And what are you the most concerned about regarding your neck and jawline? So if you guys could all start submitting your answers in a moment. I will share them for Dr. Henry to see. Mm-hmm. And you can check, I hope I did it right, that you can check as many as possible because there may be more than one concern. Anyway, so
hope you guys are having a good night. I hope this is a nice, relaxing moment for you guys to turn down after the day today. But thanks for joining us.
Yes, I know. I hope everyone's having a great day, no matter where you are in the world. It's so amazing that we can have Dr. Henry come right to your computers right at home. Okay, so I'm going to be closing this out in 3 more seconds. 1, 2, 3. All right, so let's share the results.
All
Can you see that, Dr. Henry?
Perfect. Fantastic.
So it looks like the majority of you are in your 50s and 60s. Most everyone has tried some injectables. A lot of you have tried lasers. And then actually the majority of you have not tried anything yet. So
Great.
that's exciting. And then everyone is very concerned about sagging and loose skin.
Well,
That's
you
definitely the biggest
are
one. And after that, jowls.
Well, you guys are definitely in the right place. So I'm going to talk about this at a very basic level, and you guys can really ask more details based on how much you want to know, how advanced you are in your aesthetic research. But I want to start out with kind of this quote, which I love because it's kind of my motto in all things aesthetic. It's not how old you are, it's how you are old. And so it's all about making sure that we do those procedures and make you feel like your best self. It doesn't matter what your age is, it's how you're old, it's how you live, it's giving you those tools to empower you to live your best life. And so that's really what I feel when I do aesthetic procedures, and that's my goal. And I hope that's your goal. And so I'll walk you through the steps and how to attain that. So first thing is lower face aging. So lower face aging is really a dynamic process. When we think about aging, we often think about saggy skin, but it really isn't just skin. It really is kind of a three-dimensional process. So of course our skin is aging, and part of what affects how our skin ages, there are some intrinsic factors, so some genetic factors, and then some extrinsic factors, things like our sun exposure, things like our smoking habits, things like how we treat our skin, procedures that we do in the office or at home. All of those things will affect our skin's elasticity, and our skin's laxity. But our skin alone is not the problem. We're losing collagen after the age of 25. We start to lose collagen more rapidly. But not only are we losing collagen, we're also losing fat. So the fat is what gives our skin that volume. So fat is what gives us the apple of our cheeks. It's what makes us look youthful. So when we look at the diagram below, we see that inverted triangle of youth. And a lot of that gives us that plumpness, that upside down triangle, that shape, that heart-shaped appearance that we associate with youthful beauty, a lot of that is fat. So we start to lose that fat after about the age of 30, and we continue to lose it over the course of our life. So now we've lost skin, we've lost fat. What's next? Muscle. So we start to lose our muscle tone as well as we get older. And it's really prominent in the neck, in the lower face. A lot of those muscles either become exaggerated, and because they're exaggerated, they're causing lines on the superficial surface because the skin follows the muscle, or they become lazy, sleepy, they lose their tone. And so it's not as sharp as it used to be. And then that's not where it ends. We also start to lose bone. So we get bony resorption as we get older. And so that bone starts to shrink. And because that bone starts to shrink, again, the skin is following everything below it. And that's all of that contributes to those lower face signs of aging. And in order to really properly rejuvenate the lower face, we have to think about all of those layers and restore all of those layers to really have a natural appearance. So let's start out with the skin. So some of the ways that I love to address skin laxity is through lasers. And so what lasers are doing, lasers are actually causing little micro trauma to the skin. And that micro trauma stimulates wound healing. And what's in a wound? We see collagen. So it's going to stimulate fresher, tighter collagen to tighten the skin in whatever areas you're using it. And so my favorite lasers for the lower face and for tightening in general are radio frequency lasers, ultrasound lasers like the Ultherapy. Those are my favorite lasers. Some also use, different wavelengths that are more superficial. But for my patients, I love the safety margin with radio frequency and things like the Ultherapy because it really is safe no matter your skin type. It doesn't matter if you're someone who's prone to hyperpigmentation. Devices like the Thermage, the Lutronic Infinity, the Ultherapy are all really safe and quite effective. I put in a note about Sculpture and Radiesse. So those are biostimulatory fillers, and I will use those really superficially to stimulate some collagen because they're biostimulatory. So they're harnessing your body's own ability to create collagen. So we will inject that in a really specialized pattern on the neck or the lower face to improve your skin quality, to reduce some laxity, and to stimulate some collagen. But today I am focusing more on those lasers. So Thermage is a laser. It's something we call monopolar radio frequency. So radio frequency is a little bit more superficial than Ultherapy, which is ultrasound. So it kind of bulk heats the area. And in heating the area, again, we're causing that that trauma. We're stimulating that collagen. I love both devices, both the Thermage and the L-Therapy. The L-Therapy is the device that is ultrasound, but both Thermage and Infinity are radio frequency. L-Therapy is a fantastic device. It hurts a little bit more than the radio frequency devices. So if you are a brand new person or you're a chicken like me and you really want to try something that's going to be a little bit less uncomfortable, then you may want to start out with the Thermage. I really love all of the devices. So Thermage is great for lower face tightening, tightening on the neck. Lutronic, the Infinity. So what's different about that is that's micro needling in radio frequency. So what happens with that device is the needles are introduced into the skin and then they emit the radio frequency at a precise depth. And so that gives you a really great way to target exactly those deeper tissues and structures that you want to induce tightening. I also love that device because if you also have some superficial changes, so something like acne scarring, any textural changes that you'd want to improve, you're going to get the benefit of some tightening and those superficial textural changes. So that's definitely a workhorse in my practice. I use it also for tightening, but also for acne scarring. I use it every day for acne scarring. It's an absolute workhorse. And then L-Therapy. L-Therapy is great. And if you can see here, it penetrates quite deep. And so it's probably the deepest of the bunch, really going to that same plane that we heat up when we're doing, that we're accessing rather when we're doing facelift. So we're getting really good heating with that. So I really love this for a patient who really needs good lift, stuff safe on the neck, safe on the lower face. And so a really, really great treatment. And so I love all of these. So, and what I choose for each patient really depends on the patient, depends on a number of factors: their skin type, their age, how much fat they have, their pain tolerance, if they have any textural issues on the skin. And so that's a conversation that we would have in the office. And I often use these in combination with some of these biostimulatory fillers. So there's a lot that we can do here to play around and get a customized treatment to really get some improvement in your skin laxity. And so here are just some examples of the results that we can get. So this is the patient that had Thermage on the lower face. And you can see it is a subtle result, but a result that you can appreciate. So we're not going to get a surgical result here. This is not for the patient who needs surgery, but it is for someone who wants a boost, someone who is okay with doing this periodically. So you're going to get these results are going to last for a year or two. And when patients say, well, how long do they last? It's the question is, how well do you live? Because it's going to age as fast as you age. And so there are a lot of things that we do in the office in terms of skincare and other practices to make sure that you really maintain your results. But this is kind of what I could say would be an average Thermage result. Moderate, but you can appreciate it. Again, a really well-tolerated procedure, really great for anyone. And also I love Thermage not only for the neck and lower face, but also for the body. So this is an example of results that you can see with Infinity. So I love Infinity. Again, this is that microneedling and radio frequency. So you're going to get that precise radio frequency. Those needles are going in. We can gauge how deep it goes, which is really great with this device. You're going to have a little bit more downtime with this device than you're going to have with the Thermage. You're going to have a little bit more swelling. Sometimes you can have a little bit of scabbing when we have lots of microneedling with lots of little insertion sites. But another really great device, textural change and tightening, which you can see here. And here's another Infinity result. This patient is not my patient. This is a very dramatic result. You can get great results. This picture is not average for full transparency, but you can see quite good results with Infinity. And then L-Therapy. So L-Therapy, again, has been around for a long time as well. A little bit more uncomfortable, but you can really get great lift on the lower face. I love L-Therapy on the lower face, on the neck, even on the upper brows as well. I know we're not talking about that area, but just another area where this device really shines. So really great device for lower face tightening. Another example, and this is an example of an average L-Therapy result. So you see she's got some tightening, she's has some lift here, so really beautiful result. Nice thing about this, you don't have any needles, you can get some swelling, you can get a little bit of bruising because again, this device actually emits its energy quite deep, so you can get a little bit of bruising, but patients typically do quite well. So now we're on to the fat. So we're going below the skin now, and these are the fat pads. So you can see in this patient that's younger, the age 26, the fat pads are competent, they're together, it's creating smooth, beautiful contour. And then as we get older, they start to separate, they start to sag, they start to drop. And what do we get when that happens? You start to get hollows under the eyes, you start to see exaggerated nasolabial folds or parentheses, you start to see that jowl. And so that jowl here, I don't know if you guys can see that, part of that lower face jowl is because those fat pads are starting to descend. You also can see some exaggerated or additional fat in that submental area right underneath the chin. We're not showing it here, but that's a big part of how the lower face ages. And sometimes that fat there is really kind of metabolically resistant. So it's that fat that you're working out, you're losing weight, you're at your ideal weight, and you still just can't lose it. And so we see that a lot as we get older in that submental fat. And improving that, reducing that fat really helps to rejuvenate the lower face and make it look more youthful. And so there are a number of approaches that we use. One is injectable lipolysis. There's laser lipolysis, and then there's liposuction. So laser lipolysis is cool sculpting. So cool sculpting is a device that we use underneath the chin, and you can see it here. And it freezes that fat. And so fat is more sensitive to cold than the skin. And so what the cool sculpting device does is it uses a proprietary temperature and mechanism so that you're able to damage just the fat without damaging the skin. So interesting way that we knew that this happened is that if you ever look at kids that hold popsicles in their mouths, they notice that those kids would get little dimples. And that's because the cold would damage the fat, but not damage the skin. And that we call that cold paniculitis. So that fat's getting damaged by the cold. So this is kind of intentional, induced cold paniculitis by us with the cool sculpting device. And you get the destruction of that fat over a number of weeks. So it takes, a month or more to really see your results. You'll have some swelling. This around the neck, it could be a little bit uncomfortable. I do use it on the neck. I prefer the cool sculpting on the body. I think that's where it really shines. But for someone who says, I absolutely don't want any needles, I absolutely don't want any liposuction in the neck, this is an additional option. So the next is Kybella. So Kybella is the injectable approach. So Kybella is deoxycholic acid. And what deoxycholic acid is, it's similar to what we have in our gallbladder. And so that is what breaks down our fat. It helps to digest our fat. So this is a synthetic version of deoxycholic acid. So you inject it to that area and it slowly breaks down that fat. And that breakdown of fat is permanent. When you inject it, it could feel a little uncomfortable. I've actually had it myself as well. You will get some swelling, and some that swelling can be quite pronounced. It can last for up to a month. In most, it lasts about a week, maybe 2 weeks. You can get a little bit of discomfort, some superficial numbness in the area that comes back with time. To truly get more of a wow, most will need at least 2, but you can do up to 6, separated about a month apart. And so, if you just do 2, it's a more subtle approach. So like the young woman here at the bottom, that's more of a subtle approach. The upper patient is one of the actual Kybella patients from the study, which had many, many, many treatments. So that would be the ideal approach if you're doing, up to 6 treatments to really get a fantastic result. But there is the customization there. You can do as many as you're comfortable with, as many as your budget can allow. But there's flexibility, there's no surgery, there's no scarring here. So that's a really great option for someone who does not want surgery. The next is liposuction. So this is a patient of mine, younger gentleman who, had really struggled for a long time, wanted to thin his face out a little bit. And actually in doing the liposuction, it really kicked off a healthy living and healthy habits because it gave him a real confidence boost. But this is one session of liposuction, traditional liposuction in the office. And what we do with that procedure is you're actually awake, you're up talking to us. Many patients have on their headphones, they're listening to their music, they're very comfortable. It really only takes 2 incision points. So for most, I can do it one right underneath the chin, one here and one here, and we're able to access most of this lower neck to get off a lot of fat. And this is the patient the day after. So you can see here, minimal bruising. You can see one of those incision sites still present, and really it just got better and better with time. And so liposuction is really one of my favorite procedures. I love the instant gratification of it. I love the fact that we can really debulk the neck beautifully and shape out the neck beautifully. And this patient, you can't tell as well, but I also removed some fat fat in the jowls a little bit. And so that really helps to contour the face. That area is a little bit more distendable, so you get a little bit more swelling there, so it's not as sharp yet in this photo, but we can definitely liposuction the jowl area as well, like we did in this beautiful lady. So this is a beautiful woman due to get married and just wanted to have a beautiful sharp jawline for her wedding. And so we did a little bit of liposuction here, just a tiny bit. She just needed a pinch. This procedure took 45 minutes to an hour. Again, with her, we just did one incision site. Actually, we did two, but you can't see the others. Three, you can't see the others there on the photo. But we were able to take down that submental fat and to kind of sculpt out her jowls a little bit, that fat collection in her jowls, to really give her a nice sleek jawline so that she looked beautiful on her wedding day. Again, super well tolerated. Most of my patients don't even have pain meds afterwards. A Tylenol basically is sufficient. Most don't even take that. And for, they're up and about by the second or third day. So really, really well tolerated procedure with really gratifying and pretty dramatic results. So next we're going to move on to the muscle. So we've moved past the fat into the muscle, and what muscles are playing a role in aging. So our platysma is a big muscle that kind of drapes from our pectoralis muscle, which is on our chest, all the way up to our mandible, which is kind of our jawline. And it really shapes and forms our neck and makes that nice sharp angle. But that muscle with time loses some of its tone, and it kind of falls to the middle and it starts to hang. It starts to hang, it starts to get loose, and you can also see these bands. So you see these prominent bands that we're seeing on her neck, those are platysmal bands, and that comes from that muscle starting to lose its tone. So some will look at that and say her skin is saggy, but it's not the skin. It really is that the skin is following the muscle, and that's from having those prominent platysmal bands. And so we can address that. We can address the DAO muscles, which are these muscles that pull down the face. And make you look sad. So we can address that with neurotoxin. We can also address the chin. So the chin starts to get wrinkled from that excess contraction of the mentalis muscle. And we can address all of those issues with neurotoxin, which is a fan favorite in the office. We use a lot of neurotoxin. And so that's how we address this area. So the procedure that I'm going to focus on today is using it in the neck, and we call that the Nefertiti neck lift, named after the Egyptian queen Nefertiti, who is known for her beautiful, elegant, long neck, sleek neck. And so what we do here is in really precise locations along those platysmal bands and along that neckline, we are relaxing those muscles of the platysma so that it kind of softens again and brings back that nice sharp angle. And so this is a really easy, beautiful procedure. Again, minimally invasive, zero scarring, and really gratifying for a lot of patients. It's something I do often. Okay. Whoops. We're going backwards. Sorry about that. And so last but not least, bone. So we're losing bone as well. It does not stop at fat, muscle, and skin. And so as we lose that bone, you can see here in these pictures, I love this picture to the left of the screen where you see this younger skull and the scan of an older skull where that angle is becoming less acute. So it's becoming, more obtuse and less sharp. And you can look here also when you see these three skulls, you can see how the bone is becoming thin, it's becoming wimpy, the angles are less sharp, and that's a part of aging. And if you liken the bone to, let's say, a table, and you liken your skin to a tablecloth, it's like the table is getting smaller, but the tablecloth is staying the same. So what happens? You get this redundancy, you get this excess skin. It contributes to jowling, it contributes to laxity on the neck. And so what we try to do is we try to replace bone with volume. And so I like to use dermal fillers for that. I use both the hyaluronic acid fillers. I also use a lot of calcium hydroxyapatite fillers because they're made of calcium, and there is a surgical principle of replacing like with like. And so I really like using those calcium fillers in that area because what we're looking to do is kind of restore the appearance of bone. And so I use a lot of it on the jawline, in the chin. I'll use dilute, again, radius or dilute sculpture in the neck to help with texture and tone. But when I'm really looking to restore bone, I'm doing deep boluses in the jawline, on the mandible, in the chin, to really restore that sharp, youthful appearance. And to turn, again, we talked about that youthful triangle. To turn that triangle up, we're going to make sure this is nice and sharp, that the chin is nice and sharp, that we're giving you nice cheeks to really give you that inverted triangle of youth that we know is so beautiful. Because when you have a square, heavy face, as a woman, it's masculinizing. As a man, it just really doesn't look nice. It doesn't look sharp. Even men look really nice with that nice sharp angle. So it's something that I do for both my male and my female patients. And so here are just some classic examples. So this is a patient that was treated with Juvederm Voluma. And so I love Juvederm Voluma. I use Rest and Lift. These are both thicker fillers with more G prime, so more lifting capacity. And so what we're trying to do, again, bone is at the bottom here. So we want something that's going to give you good lift, to give you nice sharp angles. So those are the 2 hyaluronic acid fillers that I use. And then again, I use a lot of radius on the lower face. I think it does a beautiful job of giving that sharp angle, giving that nice sharp chin, which looks really natural and really youthful. So those are some of my favorite procedures for the neck and the lower face. I hope that you guys enjoyed them, and I'm here to answer any questions that you have.
Wow, so much good information. I know that Dr. Henry gave a lot of details, but just remember this is being recorded, so you can always go back and watch it again. A lot of you have started submitting questions, so we'll get to those right now. Anyone else at this time, go down to the little Q&A feature, and you can ask any questions that you would like, and Dr. Henry will answer as many as she can. So let's get started. Let's see, what radio frequency devices do you recommend for under the eye bags and cheek area?
So on the upper face, I would use, really all of these are safe for that area. Probably more classically, I use Thermage around the eyes. Thermage can really give you really beautiful results around the eyes. That might be my first go-to around the eyes. But you can also do L-therapy around the cheeks, on the forehead. This entire area kind of works in concert. So you kind of need it all to be beautiful. But probably my first go-to around the eyes is I've been using Thermage around the eyes for a really long time.
Got it. Okay, here's a good one. At what age and at what point do you need a deep plane lift? Which maybe also is, when do we need surgery?
Yeah, that's a fantastic question. So deep plane lifts, that one I might send that question over to Dr. Hoffman and Dr. Brown, the 2 plastic surgeons here. But usually what I tell my patients is if you want to get more than 20 to 25% improvement in your skin laxity, then you might be more of a surgical candidate. So I'd want to see you in the office. It's not really an age because, we all age differently. So that's a common question I get is what age do I start X procedure? What age do I start Botox and fillers? And there's not one age. Some people need it at 28, someone else doesn't need it until 51. So some of it is your genetic lottery and your lifestyle. So I always tell my patients that I treat whatever I see. So when it's basically when you start to see it, if you're questioning it, now's the time to see a dermatologist, let us assess you and let us guide you as to when you do need it or how to prevent you from actually needing surgery. Because the great thing is that we have so many treatments now that the age for having a lot of these facelifts is getting pushed further and further back, because our devices are so good, our fillers are so good that we really are able to maintain patients and keep them from having surgery until they're much later in life.
All right, that's great. If you don't mind, I just want everyone to be able to see you a little bit bigger there.
Oh, thank you.
Okay, so someone's asking, is the Nefertiti neck lift surgery or an in-office procedure? How long does it take and how much does it cost?
Yes, so the Nefertiti neck lift is not surgery. It's using a neurotoxin. So neurotoxins are things like Botox, Xeomin, Dysport, Jeuveau. These are all neurotoxins. So what neurotoxins do, we inject them into the muscle and they relax the muscle so that it's not over contracting. And so it is an in-office procedure. We put a little bit of topical numbing on. The injection takes less than 10 minutes and you're out of the door. Takes about, anywhere from 2 to 7 days to start kicking in. Most people are around that 5 to 7 day mark. Will peak at about 2 weeks and will last, up to 3 or 4 months. But it is not a surgery. It is in office. You're in and out, no scarring, no downtime.
All right, so someone else is saying I missed the first 10 minutes. How can I watch it? So we are recording this. It's on streaming on Facebook Live as well, so you can watch there, or this will be available on our website and we'll send it to you all via email. Okay, so would you add filler like PRP to your Thermage treatments?
Absolutely. Zero reason that you can't. So PRP is not a filler. PRP is when we draw your blood, we spin out your platelets. Your platelets are a rich reservoir of growth factors. We activate them and then we inject them into the skin, or we use them on the superficial skin with the thought that we're kind of using those, we're harnessing your body's own capacity to create new tissue, to heal, to stimulate youthfulness. So it's not a filler per se, but absolutely, I also use fillers with Thermage, but what I like to do is separate them a few weeks apart. So about 2 weeks apart between your Thermage and those sorts of treatments. I will use PRP at the same time as lasers like the Fraxel, the Clear and Brilliant, because there is something we call laser assisted drug delivery. And so we know that lasers create those little channels. I use it also after Infinity. Lasers create little channels so that that PRP can actually access the skin better. In the same way that we think about with like cosmeceuticals and creams that we put on their skin, they're only as good as they penetrate. And so when we're able to make those little channels with the lasers, we like to take advantage of them by adding a little bit of PRP so you can get that additional benefit.
All right, here's a great one that I'm actually curious too. So they said, "You're the best, Dr. Henry. You look ageless. Are
Oh,
you
thank you.
closing your personal beauty regimen?"
My personal beauty regimen. Oh, so I do lots of things. Of course, I do a lot of skincare. I am skincare obsessed. If I had to pick two things for my skincare that I am religious with, it's my sunscreen. All times of the year, even days like, well, today was a beautiful day, but even on darker gray days, I still wear it because if there's sun, there's UV, and UV causes damage. And my retinol. So retinol is so important to me. I'm very acne prone. So I use retinol to fight my acne, to shrink my pores, to even out my skin tone, to get rid of fine lines and wrinkles. And then in terms of procedures, I do Botox. I do chemical peels maybe 2 to 3 times a year. I've done therapy. It works beautifully for a lot of my patients. For me, I'm a little chicken, so it was a little uncomfortable for me, but I do love the procedure and I saw good results. I've done Thermage, I've done radio frequency and microneedling. So that's what's in my like toolkit for myself.
All right, thank you for being for sharing that with us. So here's an interesting one about Ultherapy. There are reports that procedures like Ultherapy can give the appearance of facial fullness or fat is diminished. Is there any truth to this?
So there have been those reports, and the important part is going to someone who understands how to use the device, who doesn't overtreat, who uses the appropriate depth, and that also assesses to make sure that you are the appropriate patient. So I think it's someone who's choosing patients who aren't appropriate, using in areas that aren't appropriate, not assessing their fat correctly, being a little bit overzealous with the device. The devices are only as good as the operator. So you'll see all of these posts about therapy for I don't know $2.99 or something like that, and it doesn't matter what the price is. It really is only as good as the operator. And so yes, those things can happen, but lots of things can happen when someone who maybe is not appropriately trained or using it inappropriately. Things can always happen, but they're more likely to happen if someone doesn't really understand these devices.
Okay, well, let's stay on Ultherapy for a minute. So what is done to help to reduce the pain with Ultherapy?
So we have lots of things in the office, and I'll tell you, when I did it, I did nothing, and I'm the biggest chicken. But my patients tolerate it very well. They use topical numbing. I have patients that use Ultherapy and need nothing at all. And so, but in order to make it comfortable, I've never had a patient leave. I've never had a patient say that it was excruciating, and that's because we have all of the toys. So we can give you oral medications to make you comfortable. We can give you injectable medications to make you comfortable. We can give you something we call Pronox. So Pronox it's like nitrous. It's similar to what you get to at the dentist. And sometimes I have to pry it away from patients because they enjoy it so much because it makes them feel so comfortable and so calm during their procedure. So we offer that to everyone for any aesthetic procedure. So we have everything you need. So don't let pain deter you. It's not excruciating in that way. I've never had a patient leave. I've never had a patient be more than grateful for the procedure, or less than grateful for the procedure rather. We have anything you might need to make you comfortable. We even, if someone really can't tolerate it, for certain more aggressive procedures, we even have a team, we can call an anesthesiologist, to give you a little bit of medicine by the vein IV to make you completely comfortable.
Wow. Okay. So someone else asked to use laughing gas. So I think you kind of just
Yes,
answered that.
Pronox is laughing gas.
Okay. So I had all therapy and loved the results. I'm considering getting Infini RF now. Can you tell me what the pain level is compared to all therapy?
So in the same way, we have everything to make you comfortable. So with Infinity RF, you do topical numbing. So we let you relax with topical numbing for, a long time. And then we also do some injectable numbing. So we do a nerve block. So you really feel nothing. So we make it really, really comfortable for you.
Got it. Um, let's see. What types of chemical peels do you recommend for acne prone skin?
Yeah, so the two peels that I love the Vitalized peel, which is really great. It has a little bit of salicylic acid, it has some lactic acid, it has some retinoic acid. So that's kind of my slightly more superficial peel. I love it. It's a workhorse. And then I also use the VI peel, which is a little bit deeper. It has some sal acid. It has some trichloroacetic acid, which is a little bit deeper. It has some phenol. And so that's a little bit of a deeper peel, but still safe for all skin types. So those are my two workhorses, but of course we have lots of other peels, and what we're going to use depends on a number of factors: your skin, what your targets are, what your downtime tolerance is. So we have lots of other peels that we can use as well, but those are probably my two workhorse peels.
Okay, great. So someone said, will we be discussing laser treatments for birthmarks for people with dark pigmentations?
So we weren't discussing that this time, but we do have lasers that we can use for patients with dark marks or dark birthmarks or red dark birthmarks. So we have the great thing about the office is that we have all of the devices. It's a candy store for devices. So I see a lot of patients with dark skin, so it really is a specialty of mine. And so I treat patients with dark marks. With dark skin, it's hard because the laser gets a little bit confused between the birthmark and the skin color. And so this is really advanced laser surgery. So if you're someone with dark skin looking to have lasers, it's not something that you just go to a pop-up laser center, because it truly is advanced laser surgery. And even in 2020, I see patients that come in with burns and scars from being treated in places that don't understand this. But we absolutely have the lasers here that can do a really good job and keep you safe.
Great. All right, here's a question about the Nefertiti lift you talked about. It can make, they said, does the Nefertiti make you feel like you can't swallow, like you have that tight throat feeling?
It should not, because we're using tiny, tiny doses. And when you read the long laundry list of things that could potentially happen with using any of these neurotoxins, that is on the list. So if we were to use a lot of it, potentially, but if you think about it, a lot of these neurotoxins were used for muscle tone conditions, actually in children. That's where some of them were used first, and we were using many, many doses far stronger than what we use for aesthetics. So we feel very comfortable using them in these areas because we're using it, many times stronger in children for these spastic conditions that they have. So I feel very comfortable with the dose. But another reason to make sure you're going to someone who understands the anatomy, understands the power of these medications, and understands how to dose them appropriately.
Yeah, absolutely. Um, so what specific treatment might you use to contour and slim a fat or full neck? Not under the chin, but the actual neck.
Um, so the actual neck itself. So I'd want to see the neck because there are a few things. So fat is not always fat. One's fat is not someone else's fat. Your fat might be my muscle. So I'd want to see if it's that you really have kind of like muscle tone laxity. And maybe it's something that is a combination of muscle, skin, and fat. And maybe that might make you a better candidate for an actual surgical neck lift. So that's a conversation that we'd want to have, and we'd want to see you and to evaluate you to see if your fat is truly fat.
And with that in mind, Dr. Henry is, of course, available for in-person consultations right now, but she's
Yeah.
also available for virtual consults for anyone that, may be interested. And you can take pictures and do a video chat one-on-one with her to get an individualized treatment plan. So, how about microcoring? Someone's asking, when do you think it will be approved, and will it
Yeah.
address skin laxity under the chin and muscle looseness under the skin and bands?
Yeah, so microcoring is a good question. So microcoring is essentially you know how we discussed lasers and we said what lasers do is they create these little micro channels of trauma. And when we create those micro channels of trauma, you then get wound healing. And that wound healing causes tightening. Microcoring is similar to that. So we're taking tiny little cores of tissue out. And so because you're taking those little pores of tissue out, you get tightening because that skin is now gone, and you stimulate wound healing with fresh, tight collagen. So that has been on the horizon for a while. The results are looking good. I'm not sure exactly when it will be FDA approved or when it will be kind of commercially available for everyone. I know there are some doing it already, kind of doing it on their own, using little tiny punches to kind of mimic a proper device. But it is something that's exciting for the right patient.
All right, so let's see. How many mini Fraxel treatments should you get in 1 year?
How many mini Fraxels, like Clear and Brilliant?
I said min Fraxel treatments. I'm not sure.
So I'll answer both questions. So it depends on what you're doing, you know. So if you actually are treating something, so let's say you're treating wrinkles or you're treating a scar or, you know, tone and texture, then I say you usually need 2 to 3 treatments to fix your target. And then your maintenance after that is 1 or 2 a year just for maintenance. But I usually do 2 to 3 in kind of quick succession, so about a month apart, to really treat your target. And then after that, it's about what you do for maintenance. Now, if we're talking about Clear and Brilliant, which is more of a baby Fraxel, so very, very superficial, you can take anywhere from 2 to 6 to really get to where you need to be. And it's such a light treatment that you can get it a little bit more frequently.
All right, great. Okay, a few more questions we have time for. So let's see, a follow-up from Mike Coring. Will this be for the face or body or both?
Likely for both. You know, a lot of it was looking at this kind of submental area. That's a lot of the earlier studies are from there. There are some from underneath the arms to get some skin tightening. And so, you know, the beauty of the aesthetic space is that when things are FDA approved for a certain area, it's still left up to the physician's medical decision making and discretion to be creative and see what areas they can use it in. And that depends on a number of things: your skin tone, your skin type, the amount of laxity, the age, how you heal. And so I'm sure when it's out, lots of the brilliant dermatologists we have throughout the world will find many interesting ways to use it. But those are the 2 areas that have been at least the initial focus.
Got it. Okay, so a few more questions, but people are asking about virtual consults. What does it look like? Is there a cost for them? I think people would like to see you.
Yes, I would love to see all of you. And so I would have you call the office for the cost. But what I typically do is once we arrange the consult is that, you know, I'll have you take some really high quality photos of your areas of concern. And I'd like you to email them to me first. Then we'll get on video and have a conversation. I also want you to list all the skincare that you're using, everything you're using on your skin. And it's really nice if you have it there with you as well. And then I also want a list of any procedures that you've done and any of your lifestyle habits. So do you smoke? How do you heal? What is your background? All of these things help me to make a risk assessment on what treatments might be best for you and how you might respond to those treatments.
Got it. Okay. With the dermal fillers that create bone-like areas under the jaw, do the wrinkles also get better?
They do get better because remember when I discussed bone loss. So if you're losing bone, but the skin is staying the same, it's like the table's getting smaller, but the tablecloth stayed the same. So what happens is you get this redundancy of the skin. So if you fill out that table, you're stretching out that skin and you're reducing those wrinkles. So yes, absolutely, you're going to see improvement in tightening around the face if you do use any of those injectables.
Okay, great. All right. My screen just double loaded here. All right. So let's see, which procedure gives better results for reducing jowls, Ultherapy or Infamy?
That's a hard question. I don't know if I can answer it directly. I think they both do a great job. But again, it depends on you. It depends on your skin type. It depends on how much fat you have. It depends on, you know, a number of factors. So they both can both be equally as good, but it depends on you and which one will work best for you. So that would be a place for a consultation.
Okay, great. All right. So last question to wrap this up. You know, you've talked about so many great procedures today. How long do the results last for? Is this something people have to do once and it's done forever? Is it in every year?
Yeah.
Tell us a little bit about
So you're going to get at least a year. You're going to get up to 2 years. And then a lot of it depends on how you age. So it's kind of like setting back the clock. You don't stop aging, you continue to age. So all those good things that we recommend for good aging, maintaining a good diet, not smoking, not having bad habits, using good skincare, all of those things are going to help to maintain your results. So how long you have it kind of depends on you. But for most, they're going to get about a year to 2 years at least. So it kind of sets back the clock, a year or two.
Okay, great. So people are asking how to schedule a virtual visit and where to send the photos. So I'm going to pop in the chat here our website. I'd encourage you guys all to go to our website so you can contact us right there. There's a form and you can contact us to see all panelists and attendees. So you can request an appointment with Dr. Henry virtually if you would like. Otherwise, I do encourage you guys all to follow us on social media, on Instagram. Dr. Henry herself has an amazing Instagram page as well. So please do visit our website and follow us online to make an appointment. Any final words of wisdom, Dr. Henry?
Thank you guys. Thank you guys for being here. You took the first step, and the first step is always education and interest. And so I encourage you and applaud you to get more and more information so you can find out exactly what's right for you, so you can look as good as you feel. The office is great. We have all of the things, so really anything you need, any of your needs can be met here, and I'd be happy to talk to you.
Thank you so much, Dr. Henry. And just to remind everyone, we have our office is in Manhattan. We also have a location in Southampton, if any of you are still kind of camping out there or going there for the holidays. And we do have a number, 17 board certified physicians, dermatologists, and plastic surgeons, and they are all very versed in the topics that we went over today. But of course, Dr. Henry is available for anyone that would like to see her. So thank you all for attending. We look forward to seeing you. And thank you so much, Dr. Henry, for your time and sharing your expertise.
Of course.
You've already been on the media today, so we appreciate you. Knowledge.
No, of course, anytime.
Okay, thank you. Bye.
Thank you. Bye.